Hello, so we're getting ready to start lifespan development, and this section of the program will be divided into three separate videos. The first video will deal with from newborn to through the end of infants. The second video will include toddlers and preschoolers, school-age children, adolescents, early adults, and middle adults. And the third video will be late adults. So let's move on. So as you know, as humans, we all develop over time. Sometimes this development is more rapid than in others. This development is physically, mentally, and emotionally, emotional development. Very often the change is subtle. Sometimes it's very subtle. But as a paramedic, we need to adjust to these various changes so we can communicate with and treat these various age groups. So as I mentioned earlier, as we look at this chapter, we'll look at the various age groups: infants, toddlers, preschoolers, school age, adolescents, early adults, middle adults, and late adults. These are the age groups that the Committee on Accreditation for Paramedic Programs requires. And we'll find that you'll probably read in the textbook that the American Academy of Pediatrics may go further. They'll have different age ranges, especially between the adolescent and early adults. So for our purposes, we're going to take what's in the book, and we'll talk about physical changes as well as psychosocial changes as well. So you'll notice we'll spend considerable time on the infant and late adults and less time on the ages in between, and that's because those changes, as I mentioned earlier, are very subtle, where the from birth to infant is more specific, and late adults we will deal with a lot within EMS. So here on this slide you see a typical vital sign chart dealing with ranging from neonate to the adolescent. And you can see the various respiratory rates, pulse rates, blood pressures. You'll need to have a general idea of where these vital signs will need to be, so that as you get patients with a variety of vital signs, you'll be able to know, are they normal or are they abnormal. However, it's a good idea to have some sort of a reference, whether that be a paper reference or a electronic reference, to know exactly for the age that you're dealing with typically what their vital signs are. So it's very important to understand where these age groups, what ages these age groups consist of. So in this video we'll be talking about the neonate, which is birth to 1 month, and the infant, which is from 1 month to 1 year. So as we begin with the neonate and infant and look at their physical changes, we'll look at vital signs. And normal vital signs will vary depending on age group. The younger the patient, the faster the pulse rate and the respiratory rate. At birth, an average pulse rate is about 140 beats per minute. So if you were taking care of, say, a child that might be ill at about, say, a month old, and they had a heart rate of 130 or so, 120 to 130, we might be concerned with an adult with that high of a pulse rate, but that's going to be normal for these types of infants and neonates. So at birth, the respiratory rate is 30 to 60 breaths per minute, and tidal volume for a newborn is 6 to 8 milliliters per kilogram. This increases to 10 milliliters per kilogram by age 1. So this is important if you happen to be using ventilators. So as we continue to look at vital signs for the infants, we see a normal SaO2 or pulse oximetry is about 94%. Blood glucose level at birth is normally a little greater than 45 milligrams per deciliter, and increases to 60 milligrams per deciliter at about a month old. This level continues throughout life. In children, the blood pressure is usually directly related to weight. At birth, the systolic blood pressure will range from 67 to 84 millimeters of mercury. At 1 year, the systolic will range from 84 to 104 millimeters of mercury. A full-term newborn will weigh about 3.4 kilograms or about 7.5 pounds at birth. In the first week, they'll actually lose some weight. They'll lose 5 to 10% of their body weight and then begin to gain weight again. From the second week on, infants normally gain about 1 ounce per day. This rate of growth will double their weight by 6 months and triple their weight by 1 year of age. Now let's take a look at the cardiovascular system. Prior to birth, fetal circulation occurs through the placenta. At birth and shortly after, a complex series of changes take place. The pulmonary system develops and goes through changes as well. Prior to the infant's first breath, the lungs have never been inflated. That first breath must be very forceful. The first breath results from a series of chemical, mechanical, thermal, and sensory triggers. Young infants are primarily nose breathers for the first few months. The rib cage is less rigid than older people. The diaphragm is the newborn's major respiratory muscle. Intercostal muscles are not well developed yet. You'll see an abdominal bulge with each respiration without much chest expansion. Infants can quickly become fatigued during their breathing. An infant's airway is much different than an adult's airway. As you look at the diagram in this slide, the tongue of an infant is proportionally larger to the oral cavity than an adult would be. The airway is proportionally shorter and narrower as well. This can cause an occluded airway more easily than in older adults and children. Infants have fewer alveoli, which decreases surface area for gas exchange. It's very important for bag mask ventilations in an infant not to use excessive force or excessive volume. It's important that you have the correct size bag and mask for an infant. So let's look at some other body systems of the infant that go through change. Because of their immature kidneys, infants can become dehydrated very easily. Most of an infant's urine is water, so electrolyte imbalances are very common. Before birth, a fetus gets immunity from the mother. Some of these immunities are maintained through their first year. Infants can also receive antibodies from breastfeeding, which further supports the immune system. The nervous system of an infant is developed at birth, but continues to mature after birth. Memory and fine motor skills are not yet developed. Control of body temperature is limited. An infant is born with certain reflexes. The cranial nerves control important infant reflexes such as blinking, sucking, and gag reflexes. The Moro reflex, or startle reflex, occurs when an infant is caught off guard by something or someone. The infant opens his or her arms wide, spreads the fingers, and seems to grab at things. A palmar grasp occurs when an object is placed into the infant's palm. The infant will close the fingers around the object. The rooting reflex occurs when something touches an infant's cheek. The infant will instinctively turn his or her head towards the touch. In conjunction with the sucking reflex, which occurs when an infant's lips are stroked, these reflexes are often tested during feeding. An infant's fontanelles, or soft spots, allow the head to be molded. These fontanelles are areas where the skull is not fully formed. It assists in the birth process and lets the head be molded and formed to the shape of the birth canal. It also allows for the growth of the brain in the skull. By age 2, the skull bones will join together. One of the things the fontanelles can be used for is an assessment. A sunken anterior fontanelle may indicate dehydration. Sleep patterns develop through the central nervous system and parental efforts. Between 3 months and 1 year of life, infants will be able to sleep for about 5 hours. Sudden infant death syndrome, or SIDS, is a concern related to infant sleep. This will be discussed more during the pediatric section. As a child grows, so does the musculoskeletal system. Growth charts are used to chart the growth rate of infants and children. They are compared to average children of that age and provide a percentile. Long bones have cartilage at either end called epiphyseal plates, where the bone grows in length. As an adolescent, these plates harden and the length of bone growth stops. As the epiphyseal plates harden, they are called epiphyseal line, as you can see in this X-ray. At age 4 to 7 months, teeth begin to erupt or break through the gums. This can be a challenging time for both infants and parents because it's painful. By 3 years, the infant will usually have their full set of what's called baby teeth. At about 6, permanent teeth will start to come in, again causing a time of painful growth. Psychosocial changes of the various age groups are very important to understand. We begin our psychosocial development at birth. This continues throughout life as we interact with our parents, our caregivers, and our environment. As you can see in this chart, there are various psychosocial characteristics at various ages. The chart shows from ages 2 months to 12 months and a variety of noticeable characteristics. For example, at 2 months, the infant recognizes familiar faces and tracks objects with their eyes. At 4 months, they'll reach out to people and they may drool. At 6 months, teething begins. They're able to sit upright in a chair and speak one-syllable words. At 7 months, they become afraid of strangers, and they typically have mood swings. At 9 months, they're able to pull themselves up. They can place objects in their mouth to explore them. This can be a time of danger if they get a hold of things in the household that might be dangerous to them. At 10 months, they respond to their name, and they might crawl efficiently. At 11 months, they'll start to walk without help, and they may be frustrated with restrictions. And at 12 months, they know their name and can usually walk. The key to a happy, healthy infant is spending quality time with them. As paramedics, you'll come into contact with those children who did not have that quality time. Bonding is the forming of a close personal relationship. Bonding is based in a secure attachment. Anxious avoidant attachment is seen with an infant that is repeatedly rejected by their parents or caregivers. Infants like routine and organization. Their primary method of communicating distress is through crying. Parents and caregivers can often tell the difference between a basic cry and one that is for anger or pain. There may be another distinct cry, alarming or distressed cry. Separation anxiety is a clinging behavior and fear of unfamiliar places. It typically peaks between 10 and 18 months. There's 3 phases of situational crisis. First, the protest phase. This is rejection of other caregivers' efforts. Next is a despair phase. This is a monotonous wailing. The infant believes the situation is not going to change. And then there's withdrawal. This appears by being bored by surroundings. Infants also go through temperament or behavioral changes. These can be easy, difficult, or slow. An easy behavioral style means that they can adapt to new things easily. A difficult style means they have intense reactions and do not acclimate well, while a slow behavioral style indicates low intensity reactions and generally they exhibit negative moods. As a paramedic, you'll need to adjust your approach according to the developmental stage of your patient. If there is no life-threatening problems, you may perform an entire assessment while the parent is holding the child. Oftentimes, this will help in keeping the child calm.